Welcome to this birth prep mini course from Sweet Pea Childbirth Preparation. This class will take you from scared and unsure to focused and excited. Birth doesn't have to be scary, and a little preparation goes a long way. So let's get started. Hello and welcome. It is so nice to meet you. I am Lisa Holloway, and I'll be your teacher. I am a women's health nurse practitioner currently working in private practice, but I have a variety of experiences in my background. I worked in labor and delivery as a nurse, caring for patients having their babies. I worked in a reproductive health clinic with an underserved population, and now I'm an employee of Capital Women's Care, private practice here in Washington, D.C. I look forward to sharing all of my experiences with you and helping you pick the perfect birth class for you. The purpose of class today is to get you some baseline information about labor and birth to help you make a decision about the best class for you to prepare for that process. Every Sweet Pea Prep class will get you information and answers to questions, but also hopes to boost your confidence, reduce your fear, focus on relaxation, and will always empower you to communicate with your providers. One disclaimer before we begin: if today raises any questions that are unique to your situation, please bring them to the attention of your prenatal care provider. Every family is unique, every individual is unique, and every baby is unique. Today's class will speak to general themes about birth. Please, however, jot down your notes and bring them to your next appointment. Whether you're picking out a birth class, writing a birth plan, or just trying to figure out where to even start, the idea is that no one knows what cards they're going to be dealt. So your friend who knows exactly what she wants and feels super certain of it should not stress you out, because her upcoming birth is just as unexpected as yours. It's best to go into birth understanding that flexibility is key. It's great to have goals and it's great to have a plan. And you need knowledge to create that plan and to create those goals. But you're also going to need tools to ensure that you can ride the waves, that you can be flexible, and it will then allow you to look back on your birth experience and say, no matter what happens, it was the best birth possible, because I understand why the decisions were made that were made. And no, maybe it wasn't my plan, but it was beautiful. So this class will give you opportunities to make some decisions about the type of birth you want and the type of class you'd like to attend, and the ability to prepare for those alternatives. Have you had friends tell you that they had a great birth or that they did not have a great birth? Maybe they've mentioned a provider or a hospital that was a great experience, or the opposite as well. And what are they talking about when they say a good birth? Because a lot of people have a lot of different kinds of birth. So what makes one better than another? There was a doctor who tried to answer that question, did a whole lot of interviews and research, and created a book called A Good Birth. And she boiled down a good birth to certain themes, meaning many unique outcomes occurred, but what created a good birth for a woman, for a couple, was control, the ability to make choices, security, connectedness, respect, and knowledge. Now, these themes could then be interpreted differently by different people. Maybe you want a lot of knowledge to feel comfortable. Maybe you want no knowledge because you just want to know when it's over and be holding that beautiful baby in your arms and have the doctor or midwife tell you, you did it, it's done. So these themes can mean different things to different people, and it's important for you to understand your birth philosophy. When it comes to these themes, what are you looking for in a birth? And how can we help you achieve those goals and train for those goals? But let's remember that our bodies must work pretty well, or there wouldn't be so many people on the planet. This famous midwife, Ina May Gaskins, said this quote, which I love, because it speaks to the fear that many women have heading into birth, um, but also provides reassurance that you're part of a huge web of individuals who have done this very same thing. Why would your body be the one who couldn't do it? So, as we talk about labor and birth, I want you to have a positive attitude and and the understanding and knowledge that you're going to go into this thinking there's every reason that you can do this and it's going to be great. So, in order to pick a birth class, first you have to know what is happening to your body when you go into labor. Terms like cervical effacement and dilation are ways that we describe the process of your body laboring. Effacement is the thinning and softening of your cervix, and dilation is the opening of your cervix. So think about your uterus like a balloon and your cervix like the tip of the balloon. The effacement or thinning of your cervix is the first thing that happens, and this can happen even in the last few weeks of your pregnancy. The cervix shortens and softens with all of those Braxton Hicks that you will be or have been having. Typically, when labor begins, and meaning the regular, hard, steady work of labor, that's when dilation starts to happen, which is then the opening of your cervix. Dilation is intended to get your cervix out of the way so that you can have your baby safely. Cervixes will dilate to 10 centimeters, which is another way of saying the cervix is out of the way and now the baby can come through the birth canal. This picture demonstrates that transition where usually effacement's the first thing that happens, then dilation starts to happen, and ultimately 10 centimeters, which is big enough for a baby's head to fit, will then let your provider know it is safe for you to push and have your baby. So now you've got cervical dilation and effacement down. Check. But why are those words important? Those words are important in relation to the definition of labor. Labor is when your contractions are strong enough to cause your cervix to change, meaning your cervix starts out closed and eventually will be 10 centimeters dilated. And labor is the process of that happening, that change that's occurring. So you have to know what effacement and dilation are so that you can understand if you're in labor. Your provider can check your cervix by feeling and assessing if over time the position is changing. So true labor is when you feel contractions, which is a tightening of the uterine muscle, and it's strong enough to cause your cervix to change. That would be true labor. Now, there are situations where you can contract and not change your cervix. This would be false labor. Have you ever had a friend go to the hospital when they were at the end of their pregnancy and tell you that they got sent home because they weren't actually in labor? Well, this is what they're talking about. Often it happens right before labor begins, where you can feel very uncomfortable. You can feel uterine tightening, but it's not actually quite strong enough yet. So this would be false labor. When you are timing contractions and trying to communicate about contraction frequency, you time contractions from the beginning of one contraction to the beginning of the next. Your contraction is like a bell curve if you're visualizing it. That beginning of the bell curve, we start our stopwatch. Contraction comes, contraction goes, you get a little break in between, and the next time the next contraction starts, you stop your stopwatch. So when someone says, how far apart are your contractions? Or are your contractions coming regularly? That's what they're talking about. The beginning of one to the beginning of the next. When you're in true active labor, contractions typically come about every 5 minutes, like clockwork. Prior to that hard, steady work of labor, it can be quite irregular. So, in that early stage where false labor can occur, you might have very spaced out or irregular contractions. As labor intensifies, it becomes more regular. But as a refresher, labor is when your contractions are strong enough to change your cervix. All right, so it's important to know what's happening inside of your body while you are laboring so that you can use tools, whether it's movement or breathing or relaxation techniques, to help your process along. Gravity and movement are your friend. And so as people pick birth classes, they're picking the training that they think is going to speak to them and resonate with them the most to aid in the process. This picture that you're seeing is showing the top of a baby's head coming down through the maternal pelvis. Babies have fontanelles on their head, so a front opening or soft spot and a back soft spot. And those are the places where the plates of the skull are not yet fused together. This allows for your baby's head to compress and more easily descend through the pelvis and the birth canal. We're pretending this is my baby here, this sweet little baby doll. And I'm going to show you how your baby is moving down and rotating on the way out during labor and birth. So many women are feeling kicks under their ribs while they're pregnant. So if this was my baby, maybe the baby's kicking me under the right side of your ribs. That's a very common way. Don't freak out if your baby is not doing that. But that's a very common way for labor to start. And as you can see in that top left picture, that baby's fontanelles are sideways. So a front and a back fontanelle, if this is my baby, right, down through my pelvis. As you labor, baby's going to rotate to a face down position, ideally. It's not that babies can't be born in other positions, but this is the way that allows for the most narrow part of the baby's skull to pass through the birth canal. Ultimately, if this was my baby coming down in a face down position, we're going to get a nice chin tuck, and that crown of the head will be that presenting part. The head has to come down and under the pubic bone. The pubic bone is the bone here on the front of your pelvis. The head rocks down and under. And then once the head is delivered, the body rotates and the shoulders are delivered. Your baby is then out and given to you, and life begins. So as you consider movement, as you consider relaxation of the pelvic floor muscles, we are educating ourselves to better be able to get through that process and help your baby more quickly and safely descend and rotate and for baby to be born vaginally. The different stages of labor can look different from each other. As an observer, when you're watching a woman go through labor, there are hallmark cues to let you know where you may be in the process. I share this with you so that you can understand just a little bit more about what birth looks like, and I hope it helps you decide on what tools might be most beneficial for you to train and prepare for this process. Decisions to train, to practice, to choose a course should be based on your goals for your birth, but also just understanding a little bit about what you'll need in each stage. So, contractions that get you to 10 centimeters are the first stage of labor. That then is broken down, those 10 centimeters is broken down into 3 separate stages. The first 3 or 4 centimeters tends to be a lot of long and irregular contractions. This is often that false labor where women get sent home because it can take several days for these changes to occur. Active labor is about 4 to 7 centimeters. It's the hard, steady work of labor. The cervix tends to dilate a bit more consistently. Often women who are planning on an epidural decide around this time they're about ready because something's shifted. Their body has sort of stepped it up to the next gear. Transition is the last few centimeters of dilation, and It is the equivalent of rolling down the backside of a roller coaster, right? That active labor is taking you to the tippy top. You're getting to the top and you roll down the back. When you roll down the back of that roller coaster, it's quick, it's intense, and transition is just that way. You might feel shaky, nauseous, and you might have a lot of emotional changes. Women in transition tend to be tearful, have a lot of self doubt, and maybe they've been doing awesome and all of a sudden they're thinking, I can't do this anymore. Women in transition need a lot of support when they are unmedicated. And so a knowledgeable birth partner is going to be an important part of an unmedicated birth, especially at the time of transition. Some of the physical changes still happen when you have an epidural, but they're not quite the same intensity of emotional changes when you have an epidural and are going through transition. So once you're fully dilated and your provider checks and lets you know it's safe to do so, with the assistance of your medical provider, you'll push and ultimately deliver your baby, which is stage 2. And then once that baby comes out and you're holding your sweet new baby, ultimately the placenta has to be delivered as well. Baby is disconnected from the placenta. Placenta is delivered with 1, 2, 3 maybe pushes. It can take a little time for the placenta to separate, but it naturally does that, and your provider's ensuring that that process goes smoothly. If you learn one thing today, it's the concept of the fear, tension, pain cycle that will carry you through your birth. The idea is so important. It was created by Grantley Dick Reed. It's a theory that when you are fearful, you are more tense. And when you are tense, you feel more pain. When you have pain, you then are more fearful. And it goes round and round. We need to break this cycle for birth. We need to reduce fear. We need to reduce tension and help you feel less pain. There are ways to do this. Even just this course today, I hope helps reduce your fear. I hope that you'll consider a Sweet Pea Prep course because we focus on this concept intensely. I aim to reduce your fear and give you tools to reduce your tension. So many classes out there work on reducing tension, but don't necessarily provide you the information you need to reduce your fear. Think about when you're watching a scary movie. What does your body do? You tense up, your shoulders go up, you grab your partner, maybe someone jumps out of a closet and you give a little yelp, In that moment, can you breathe? Can you mentally tell yourself that you're going to be okay? Those are the kind of techniques that women are being educated on as they prepare for birth. And when you're selecting a course, keep it in mind that reducing fear, reducing tension is going to help you navigate your birth a bit more comfortably. When you're choosing techniques that you want to learn to prepare for labor and birth, you're thinking about your overarching goals. You're trying to reduce your fear and tension. But the ultimate goal is really relaxation. It's the single most important thing you can do and the cornerstone of comfort. Relaxation, being in a relaxed state, means muscles are relaxed, mentally you are relaxed. And no, it's not going to make your contraction pain go away, but all the techniques that are taught, whether it's hypnosis, using water, using massage, using touch or visualization, movement, partner involvement, all of the concepts that are taught to prepare for birth are with the goal of relaxing. Relaxation is the focus. If you've ever meditated or done yoga, you maybe have a little more knowledge of what that feels like. But any course you take is going to be designed with the goal of helping teach you, helping you practice, and getting you the information you need to be able to relax through labor. I love sharing this labor pledge because as you think about labor and birth, you might be feeling a little bit worried, scared, uncertain. You might be thinking, Lisa, I know you can do it, but what am I going to do? How am I going to do it? And the truth is, all you can do is your best. You're going to aim for the birth of your dreams. You're going to learn the tools to help you get through, and then you're going to work hard, try your best. Focus on your baby, share your wishes, use your voice, move your body, give yourself a break, and just do what you need to do and be present in this amazing, life-changing experience. All of this hard work is intended for you to meet your baby. And when you're getting through those contractions, you're going to want to remind yourself of that regularly, that this is not just endless pain. This is not purposeless pain. This is very purposeful for the intention of meeting the newest love of your life. Thank you so much for spending this time with me. I hope you have found it helpful. I know there's a lot of choices out there when you're trying to decide on a birth class, and I hope getting a little bit of baseline knowledge is helpful for you to make your decisions. I wish you the best in your birth experience. If you're interested in Sweet Pea prep classes, Birthing Basics is a great place to start. There's also Birthing Basics Plus, which takes a deeper dive into preparation for an unmitigated birth. I hope to see you in class.